Hello, my name is Tina Rodwell and I have a 13-year-old son who has myalgic encephalomyelitis, or ME. He was 8 when he first became ill, and this is the second video in a series of 3 where I'll be trying to explain the effects of activity on a child with ME. Taken from my experience and other carer and patient's perspective, I have listened to many patients that have suffered this illness from the same age of my son, who are still severely affected 20 years on. These videos are all based on our collective experience of living with this condition. I explained in my first video the confusion between professionals themselves about post-exertional malaise, or PEM, and why it is not easy for patients or parents like me to understand, and it's not easy for the doctors. We are not given any of the correct information. We are hoping to change this through the NICE guidelines. I would first like to explain the duty of candour. It states, being open, principle and ethical duty of openness apply to all incidents and any failure in care or treatment. See Appendix 1. The duty of candour applies to incidents whereby moderate harm, sufficient harm or death occurs. Now, in 2015, there was a landmark case that set out patient consent. Doctors must now ensure that patients are aware of any material risks involved in a proposed treatment and of reasonable alternatives following the judgment in the case of Montgomery versus Lancashire Health Board. Now, the GMC chief executive at the time, Niall Dickerson, said, "We are pleased that the court has endorsed the approach advocated in our guidelines on consent," and I'll paraphrase what that actually means. Good medical practice and consent means patients and doctors making decisions together. Make it clear that doctors should provide person-centred care. They must work in partnership with their patients, listening to their views and giving them the information they want and need to make decisions. And that must therefore go for the parents also. We cannot do this in ME if we don't understand PEM and what it means to the patient and the parents and their families. The patient cannot make a decision, or the parent on their behalf, if they do not understand the terminology used. Doctors cannot diagnose PEM due to the National Health Service not giving the correct information to enable them to do so. Everyone needs to listen to patients' experience and robust research that has good ethics and practice that look into PEM or any form of activity that affects an ME sufferer's ability. So, we need a way of measuring the negative or the positive impact of treatment or activity, enabling the child to get the best out of their lives living with ME. We obviously don't want to do further harm, but we do need to support our children to have some form of normality in their daily living without causing more severe symptoms. Because exertion does not cover the whole spectrum of activities that affect the PEM cycle, I prefer the term post-activity increase in new or severity of symptoms, in short, PAINSS. It is easier to understand for us parents and tells you and the doctor exactly what is happening to your child's body as they go through this cycle of deterioration after, say, reading a book or looking out the window. These activities sound benign, but can cause a severe sufferer to go deep into pain cycle, and using those 2 examples doesn't really relay how it is for a very severe person who just entering a room can cause that cycle to happen. PAINSS reminds everybody of the harm that can be done if you exceed your body's boundaries. However, these boundaries are limited, so emotionally hard to live with for the child or their parents and family. This is never understood, and no support is given to the child to enable them to cope with that, or their families. And it really is a sad fact of ME how disabling it is. You also need to adapt those boundaries as your body starts to recover or change, and that is really difficult. So, understanding PAINSS will support your child to paint their own picture of ME and not have a narrative forced on them by professionals that do not live with this chronic illness. It will support the medical and other professionals to understand your child's needs and the support they and you need as a family to achieve patient safety and the best quality of life for your child, which is what we're all aiming to do. So how can you put PAINSS into practice and make sense of it all and achieve the best outcome for your child? We first need to understand the cycle of PAINSS, how different activities affect the individual child, understanding the cycle of deterioration of ability and measure with objective measures, actively looking out for the uplift in ability and waiting in the space your body needs to mend from the activity you have just tried. Following the circle of PAINSS will also help you see if treatment has helped or caused harm, so that you, your doctor and other professionals can make an informed decision based on your child's ability and reaction. I will cover this in more detail in the next video. I will just take you through the circle of pain for now. So if we look at the circle, I hope you can see that. We start at the, it would help if I got it the right way around, wouldn't it? Yeah, no, here we go. So we start at the very beginning of what we call a baseline, and we'll go into that further. But what you've got to remember for your child, say you're going to have a friend round to look at a film. You're not just doing one activity, you're doing many. You first got the excitement of a friend coming round that your child is looking forward to. You've got the cognitive, because the child is thinking what to say to their friend and how they are going to react to them, because children are very aware that their ability has gone down and that their friends can do much more and they can't keep up. So that's got to be remembered. And also then you have the film, which is sensory, and flashing movement on the screen sometimes can set PEM off. So they're all different activities with one big activity. So that's what this is for. And then we go into the elation, which starts before the activity because you're excited in doing something different. And then you have an increase in severity or new symptoms come along, and you have to stop and really be mindful of this. And pacing doesn't really help with this procedure, because even if you pace and you rested, your body is still actively going into the PEM cycle. And then you get a stability in the new symptoms. They probably disappear or they abate a little bit. And the same with the symptoms that you had at your baseline. They're stabilising. And at this point, we all think that, oh, we could do something else now. That's not going to have an effect. But what it does, you try something else in this particular area, it pushes you right back to the beginning again, and it pushes you back deeper into severity, and it also brings on new symptoms. So you must be mindful of that. When you reach back to your baseline, again, we think to ourselves, we're okay, we can try another activity. But in reality, if you do, that's going to push you back round here, and your body has done none of the mending. So if you stay in this area where you're at baseline again for a couple of days or longer, depending on how that child's body reacts, then your body has a chance to recover what it needs to enable you to try the activity without having so much pains afterwards. I hope that explains a little bit about the circle of PAINSS. In the next video, I'll take you through logically how that actually works in practice and how we can measure the ability so that we understand the severity and the harms that can be done with an activity if you're not very careful. Thank you very much for listening.